Hey everyone, Dr. Chris Stansbury here with West Virginia Eye Consultants, back to you with another episode of West Virginia Eye News. August is Children's Eye Health and Safety Awareness Month, so I wanted to spend a little bit of time talking to you about kids and their visual needs and the type of health and safety things that y'all need to be aware of. So we're always thinking about going back to school. Obviously this year is a little bit different with COVID-19 and all the things that are going on with it. But do think about getting your kids in for a vision exam before they start school. It's coming up pretty quickly, so if they haven't had a checkup in a while, or if they haven't had a screening or a checkup at all, be sure to get them in before they start school. Children's vision issues can often go undiagnosed, and so they may have an issue with seeing, and they may not know that they have an issue. Kids don't know what they don't know, so they get into school and they're having problems in the classroom. They're not reading well, they're missing lines, they have a poor attention span. Some of those things can be related to vision issues. So you're always better off to get them in and get them checked. And that way we can determine if there's any problems with the way they see, get them some glasses, and give them a good shot at having a great school year. So think about getting the kids in before they start school or soon thereafter. As far as safety goes, I always recommend if kids wear glasses to use polycarbonate lenses. Polycarbonate lenses are impact resistant, so they have a much lower chance of breaking, and they don't shatter like traditional plastic lenses. They absorb the impact, they deflect the impact, and they don't shatter and break into pieces. So if kids are active, they play sports, or just even out on the playground, getting hit with a ball, much lower incidence of issues with polycarbonate safety lenses. So I typically always recommend polycarbonate lenses for my kids and even adults who are active and could take a shot to the eye. So think about polycarbonate safety lenses for the kids. Also, if they're involved in any sort of sports, especially things where there are things that could fly at the eyes, baseball, softball, those types of things, think about getting them some recreational glasses. Those could be sunglasses, they could be prescription glasses, but they wrap around. They come in sun tints and clear, but they provide eye protection. So another way to keep the kids' eyes safe during sports. Also, if they're into outdoors activities like shooting a BB gun, a bow and arrow, airsoft guns, even Nerf guns, think about putting safety glasses on the kids for those activities. There is a chance that those things can ricochet, bounce off of a hard surface and come back at the eyes. Or kids being kids, sometimes they tend to shoot those things at each other, and an impact with the eye could cause some serious damage when we're talking about BBs and airsoft pistols and other things like that. So if they do enjoy those types of activities, put some safety glasses on them. If they're outside a lot, get them some sunglasses. We think that the sun exposure that we have over the course of our life is linked to macular degeneration, is linked to cataracts. So getting kids into wearing sunglasses at a young age is definitely going to help them over the long haul. So don't have to be really expensive. Just make sure that they are 100% UV blocking, and get them a pair of sunglasses, get them to start wearing those in the outdoors. If you have any questions about vision issues that your kids may be having, or you want to get them in for an appointment, give us a call, 304-343-3937, and we'll be happy to chat with you about that. So let's get those kids in here, get them checked out. Hope everybody has a great school year, and we'll see you guys again real soon for another episode of West Virginia Eye News.